The DOC is still working to try to get obviously as many of our staff and inmates vaccinated as possible. The numbers keep moving, but they seem to be moving a little slower now that we've reached some of the higher figures. What are your thoughts on where we are as an agency in respects to our efforts in getting inmates vaccinated?
So I actually believe that we're in a place where we have actually done well enough so far that we need to really expect ourselves to continue to do better. I think the DOC has done a wonderful job, and I appreciate the work that the Virginia Department of Health has done working with us, and the Secretary of Public Safety in advocating for our patients and our staff to have access to the vaccine. We have in many ways done better than the general public has been able to do. And as a result of that, have been able to provide safety within our facilities to the persons who are incarcerated here, the residents, as well as the staff. I think we have to continue working really hard. There's going to continue to be challenges. We're not out of the woods yet, and we have to really be vigilant. So I think we really want to continue the good work that we've started.
Very good. Obviously, there are those who still feel hesitant, for a number of reasons, whether it be, concerns about safety, whether it be concerns about side effects, the vaccine interacting with other health issues. Talk a little bit, if you will, just about the vaccine itself, its safety and what we know about it at this point.
Yeah, I mean, there's a number of different vaccines that are currently used in the United States. Within the DOC, we're very largely using the Moderna vaccine, which is a 2-dose vaccine with the doses separated by 28 days. There's a range for that second dose, a few days early, even up to a few weeks late at this point. Those vaccines actually aren't new. The vaccine, the kind of vaccine that we're using, has actually been around for well over a decade. It hadn't had the same amount of commercial applications as other vaccines like an influenza vaccine or otherwise that we might see. But it's not new, so we had some pretty good evidence on those to start with. In addition to that, the clinical trials, people seem to think that there's no evidence for these vaccines, that we don't have data. The government just said, let's just stick it in people's arms and run with it. There were over 75,000 persons who received these vaccines like the Moderna vaccine, as part of the trials to determine its safety. And even though we used as a government what's called an emergency use authorization, the steps to ensure that that vaccine is sufficiently safe were all still taken during the course of the conduct of those trials, the review of the evidence by our national experts to determine how that should be used. And really, since the vaccines came out, if you remember, it feels a long time ago, but it was back in December that these vaccines were getting approved, and we were beginning to see access in January in the DOC. Since that time, there's millions and millions of vaccines have been distributed around the United States, and every time somebody receives a vaccine, there's monitoring that goes on to determine what kinds of side effects people have had, if it isn't working, and we continue to gather all of that data. So the further along we get, the more and more data we have. And I really think at this point, the safety profiles are reasonably well understood for Moderna vaccine that we're using in the DOC. That to really continue to hold out is unsafe for yourself. It's unsafe for the people you're around, your family, your friends, your children, your parents, the people with whom you work, and really the residents of our facilities, the persons who are incarcerated here, and need us to be safe for them too.
Absolutely. Recently we did have an outbreak at River North Correctional Center. Some of those individuals had been vaccinated, but you can correct me if I'm wrong, but I believe that the result of that outbreak was that many of them showed no symptoms. And in terms of comparing to previous outbreaks at facilities of comparable numbers, it was relatively mild compared to some of the previous incidents. Would you agree?
Yeah, I would agree. The vaccine does appear to work, and in a situation like that, there's no such thing as a perfect vaccine. What we see is a vaccine like Moderna. 95% of people will respond to it, meaning that out of 100 people who get it, there's going to be 5 who don't respond to the vaccine. And as a result of that, there is still the possibility that even in a completely vaccinated population, people can still get sick. It's one of the reasons that we continue to say, wear our masks, wash our hands, stay 6 feet apart, keep surfaces, keep environments clean, do all the things, cover your cough, do all the things we should be doing to minimize the risk of an exposure and the subsequent development of an infection. So no vaccine's perfect, but what we seem to be seeing with Moderna is that even after the first dose, within about 2 weeks, it appears that there is a sufficient response in folks that we're reducing transmission of the virus. People are getting exposed, they're not getting sick. If they are getting sick, they're not getting as sick. So we're reducing what we call morbidity or illness from it, and the adverse outcomes, the bad things that happen when you get sick, just as you mentioned, the hospitalizations. So that vaccine actually, even after the first dose, is proving to be helpful. And it's really after the second dose, about 2 weeks out. The reason we say 2 weeks out is that's really where the initial data came from. We looked a couple of weeks after the second dose to see how people responded. It's where we feel most comfortable. But now after using the vaccine quite a bit more, we're seeing that there's benefits even after the first dose. So people really should be getting the vaccine, and they should be getting that second vaccine and continuing to do all of the things that we've asked. And CDC has asked, everyone's on the same page, wearing masks, covering coughs, social distancing, really being smart.
Yeah, we've had some folks who have asked whether or not as restrictions and such in the community are being lifted or at least softened a bit, that wondering when or how we're going to do that within the DOC. And I think our message has been clear that in these congregate settings we still have to maintain our integrity when it comes to keeping the inmates and our staff safe. How would you respond from the medical profession as far as the difference obviously between these congregate settings and what we're seeing in the community?
Yeah, so when we think about health, we can think about it 2 ways. We can think about the health of an individual, but then we also think about the health of a population. And public health is really all about thinking populations and then asking individuals to participate in a way that not only keeps themselves safe, but keeps others safe too. Congregate settings are unique. People don't have the same ability to move in a congregate setting, to escape infection, to quarantine, to isolate safely, as one might in the community. The number of options aren't there. We talk about a concept called herd immunity. We hear it all the time as it relates to the vaccine. Maybe in the community, if 7 out of 10 people are vaccinated, then we might be at a point where it's really hard for the virus to keep transmitting. It's not the same in a congregate setting where there are more people confined to a space and have less options to kind of move away from a source of infection. It's probably more like 9, if not even a little higher maybe, out of 10 people need to be vaccinated in order for us to be safe in congregate settings. So that means it's even more important in congregate settings than it is in community settings to adhere with mask wearing, to adhere with hand washing, to cover coughs, to stay socially distance, because once coronavirus gets into a congregate setting, it can move more easily because of the way congregate settings are set up. The other issue that I think people don't think about quite so much, and we're hearing a little bit more about it, are some of the variants of the virus. We started out with a particular virus in the United States that was most common, and it has certain characteristics for how it moves between people. And what we've seen over time is now there are over 700 variants of this coronavirus that we see just through routine surveillance in the United States. Those viruses can each be somewhat different. And so if we were to just immediately relax precautions in congregate settings and a particular variant gets in that the vaccine doesn't work really well against, or maybe not at all, the only thing we have to rely on is those what we call mitigation strategies, preventative strategies, like wearing the mask, washing the hands, staying apart. We've already seen that actually those can work regardless of whether we even have a vaccine or not. They are not as good as the vaccine, they're not as good as the combination together. But if we get exposed to a variant, the impact to everyone in the congregate setting, the residents in the facility, the staff, they can be much more severe. That's why we need to think of that congregate setting as a place where we really have to all work together to keep ourselves safe or continue doing the things to protect the congregate setting and the individuals in it.
Very good. Dr. Targonski, we've got several, pieces of information coming in with different reasons why, people are concerned about the vaccine. And we've heard that people are concerned about fertility and having an impact on fertility. We've heard about, impacting their joints. We've heard about, altering their DNA. We've heard about just various things that people have said that they're concerned about or they've heard about out on social media, all over the internet. Your thoughts in response to folks as far as making sure that they get proper education about this vaccine and what it is and what it isn't.
Yeah, I love your emphasis on quality information because we live in an era where it's incredibly easy to get all kinds of information. And it's oftentimes very challenging to be skeptical, to really look at that information and determine if it's reliable and credible. And the reality is there's a lot of bad information out there everywhere, whether it's coronavirus or vaccines or otherwise. And so I do think the most important thing is identifying those reliable sources, the Centers for Disease Control, the National Institutes of Health, working through our own health services here in the DOC, VDH, for staff, your own medical providers, and really feeling comfortable asking them the hard questions to say, why do you believe that as a medical provider? Where did you get that information from? To make sure that they're good, credible, reliable sources. As regards fertility, it's a really important issue for all of us, right? These are our families. These are our futures. So we should take these kinds of things seriously. The CDC initially, when these studies were done on Moderna, again, about 75,000 people in the trials, but they really didn't recruit folks who were pregnant. What they've subsequently seen, however, is that a pretty significant number of folks, thousands and thousands, actually became pregnant or became pregnant during the course of the trial, after the trial, and have allowed us to observe what's happened in those circumstances. We've also seen subsequently with the millions of doses of vaccine that have been delivered, vaccines going to women who were pregnant, women who subsequently became pregnant. We're really not finding any adverse outcomes as it relates to pregnancy in women who've taken the vaccine compared to those who didn't. And so our scientific data are pointing to that. To the best of our knowledge, it's relatively safe. We will always continue to look at that data to make sure there's not something that we miss, because we all agree that it's very important. But for right now, certainly all of the major expert associations, collections of individuals in medicine who are working with pregnant women, the Centers for Disease Control, the Society for Maternal and Fetal Medicine, the American College of Obstetrics and Gynecology, they're all recommending the vaccine. It's a discussion you should have with your provider. But don't forget, COVID poses pretty significant risks for pregnant women too. Pregnant women are more likely to be hospitalized. They're at higher risk of bad outcomes, even death, once they get COVID. So we want to prevent COVID. We wear masks, we wash our hands, we stay 6 feet apart, we keep our surfaces, our environments clean. But pretty much everybody feels that the vaccine is a good idea in the case of pregnancy. Or those thinking about becoming pregnant, and we just haven't seen the fertility concerns in any way. Joint pain, look, when you get a vaccine, it's like any other vaccine. It's telling your body to rev up and do some work to build protection. That means when our body revs up, we sometimes will have side effects. We have absolutely seen people get the COVID vaccine and they get headaches, they get muscle aches, they get joint aches. Some people get nausea, some people get stomach sick enough to throw up, people get fatigued for a day or two, but they're not getting COVID. And, you know, a headache for a day or two, some muscle symptoms, or the risk of COVID. It's where we have to project ourselves into the future and think about our safety intermediate to long term versus managing a headache over a day or two. So absolutely, people are going to get muscle aches and joint aches and be a little more fatigued for a day or two. It's possible. Not everybody gets that. 5% of people get headaches, 10% get muscle aches, roughly. You know, you might get them, but guess what? You're better protected against COVID. Seems like a good trade-off. And it's a trade-off. I happily discuss that with all of my patients. And I recommend the vaccine. We can work through the side effects.
Awesome. Awesome. Dr. Targonski, thank you so much. And thank you, your staff, our health services team, all of you who've been really on the front lines in battling this pandemic. Really appreciate your time today, but also just appreciate the work that you've done over the years for the department and your message today to us, to everyone, our staff, our inmates, everyone who will see this video. Thank you for sharing that message with us and encouraging us. I'll give you just a final word to offer any final thoughts, on our topic today.
This is incredibly important work, and it's incredibly kind of you to thank those of us in the health professions for doing what we do. But everybody in the community is important, and everyone who's working to protect themselves, protect others, is also doing tremendous work to help us kind of get rid of this COVID pandemic. I don't think we should go without thanking all of the residents in the facilities that are working really hard in our communities here at each facility to protect it and make it safe. We've had a number of occasions where persons have acquired COVID, and it's been through the very thoughtful ways in which the residents here have protected others once they were infected or thought they might have been infected, that helped all of us to stop an outbreak from happening and save people from being sick and save lives. So it's everyone's effort, and I really think everyone should take a second to be proud for the work they've done to protect others and to keep themselves safe. And we as health professionals thank you for that. So I appreciate you letting me say that.
Absolutely. Absolutely. Dr. Paul Targonski, thank you so much for your time today, and I wish you well. And hopefully we can get through this thing and put it behind us at some point in our future. But thank you. I appreciate your time.
You as well. Appreciate it. And thanks for the hard work, everyone. Bye-bye.